Congratulations on making the decision to have total joint replacement surgery and choosing Providence St. Joseph Health. Our goal is to help ease your way from experiencing pain and limits to your activity to returning to more normal activities. We are here to provide high quality and compassionate care to help you meet your discharge goals. In this program, you will learn about preparing for your surgery, your surgical stay, and your therapy after surgery. There are several things that you'll need to do to prepare for your surgery. Remember to bring an updated list, including dosages and frequencies of all your medications, over-the-counter preparations, and herbal supplements. You may have given a list to your surgeon's office, but it is always best to update it and make sure it is correct. Bring your eyeglasses, hearing aids, and any other orthotics or braces you use. Wear comfortable clothes when coming for surgery. A comfortable t-shirt or top and pants that are loose enough to pull up over your dressing are good choices. It is important to notify your surgeon of any changes in your health prior to surgery. The #1 reason surgeries get canceled on the day of surgery is because there is a break in the skin that can be a source of infection if surgery is performed. Call your surgeon if you have any issues with your skin or show signs of a cold, sore throat, fever, or any new health problems. Now is the time to make some simple preparations that will increase your ease, comfort, and safety when you are at home recovering from your surgery. Look around your home. Are the pathways clear and clutter-free and wide enough to allow the use of a walker or crutches? Throw rugs are a big safety hazard. Roll them up and put them away, or use double-sided tape or non-slip backing to secure them firmly to the floor. Consider adding extra lights, such as a night light or motion-sensitive light in hallways and on the path to the bathroom. Prepare meals ahead of time and freeze them for later use. In addition to preparing your home, we will show you exercises to complete on a daily basis. These will be important to do before and after surgery to build your strength and flexibility. Whether your surgery is at Providence Medical Park, Providence Holy Family Hospital, or Providence Sacred Heart Medical Center, you will need to arrive 2 hours before your surgery or as instructed by your surgeon's office. You will check in and be taken to a pre-operative preparation area.
Your surgery's all through. It's time to wake up.
After surgery, you will be taken to the post-anesthesia care unit. Your stay is typically an hour or longer. Your vital signs, blood pressure, temperature, pulse rate, and respiratory rate will be closely monitored. After you have recovered from anesthesia, you will be taken to the area where you will continue your recovery and see physical therapy.
Slow breath so that this yellow part stays nice.
We will encourage you to cough and deep breathe to re-expand your lungs and decrease your risk of pneumonia. You may also receive some oxygen until you are fully awake and breathing adequately. Your vital signs will continue to be monitored frequently. You will have an IV in place to replace fluids lost during surgery and provide a site if IV medications are required for nausea or other side effects. The IV will be capped off when you are taking oral fluids in sufficient amounts. Tell your nurse if you are experiencing nausea, itching, or other side effects so medication can be given.
See if it's safe to give you some ice chips yet.
You may not be ready to eat right away. Your nurse will offer ice chips or oral fluids slowly. Once you are ready, Your nurse will make sure your meals are ordered. You may have support stockings that are worn for several weeks. You may have sequential compression devices that help move blood out of your legs into your circulation. We will encourage you to pump your feet throughout your stay so blood continues to move in your legs and you are less likely to form clots. Medication is also used to prevent blood clots from forming. Your surgeon will choose the best one for you based on your risk factors. You will receive written instructions about your specific medications, how they should be taken, and side effects to watch for. You will continue these medications for a period of time after discharge. You may have cold therapy to help minimize pain and swelling at your operative site.
1, 2, 3.
The nursing staff will help you reposition in bed to help with pain management, to protect your skin from pressure, and manage swelling. If you have had a total knee replacement, do not place pillows directly under your knee, as this will interfere with straightening or extension of your knee. A whiteboard on the wall helps us track your needs. It will show when pain medication is available, how you are progressing with physical therapy, and who your nurse and aide are.
Fill in this stuff so that every time somebody goes about pain management while you're
The
here.
goal for managing your pain is to have you comfortable at rest without being too sleepy and able to participate in activities and therapy. We will talk to you about your pain to help determine the proper medication, dose, and frequency to best manage your pain. Pain management is a team effort between you, your nurse, surgeon, and therapist. We use a 0 to 10 pain scale. 0 refers to no pain present, and 10 is the worst pain. We will ask what an acceptable number is for you and what number represents your current pain. The scale helps us to adjust your pain medication. Everybody reacts to pain differently. Do not compare your pain to anybody else's pain. If you have chronic pain, we ask what medications have worked well for you in the past. We will ask what you were taking at home before surgery. Your accurate answers will help us to meet your chronic pain needs as well as manage your new surgical pain. Your physical therapist will work with your nurse to time pain medications before therapy treatments. Therapists are good problem solvers, so we recommend you asking for their advice if you have a unique or unusual physical or home situation. Physical therapy will begin soon after surgery. The earlier you get moving, the better your outcome. Physical therapy will work toward preparing you to return home safely by assisting with range of motion and showing you exercises to improve your strength and mobility. A cooling machine or ice will be used to help manage your pain and reduce swelling. You will start walking using your front-wheeled walker. Pain should not interfere with your participation in therapy or with your daily activities, such as toileting or dressing. Notify your nurse if your pain is not under control. In therapy, you will work towards some goals. Be able to safely get in and out of bed and walk with an assistive device. Correctly demonstrate your home exercise program. Be able to safely negotiate stairs. Have all your equipment needs met. Have your family caregiver training completed. It is important not to get up without help after surgery because you have a higher risk of falling. Your therapist will let you know when you are safe to progress to a higher level of independence. Your nurse will also discuss your safety needs.
We're just worried about.
Discharge planning should begin as soon as you plan to have surgery. You may go home the day of surgery or the next day. Discuss your living situation and needs with your family and friends. Specific needs should be addressed with your surgeon. Your physician, nurse, and therapist may give you things to think about. If you have had total knee replacement, you will have continued therapy at home or as an outpatient. If you have questions or specific needs, please speak to your surgeon before surgery so that plans can be made. At the time of discharge, your surgeon will write orders and prescriptions. Please plan on about 2 hours for paperwork and final orders to be completed. You will receive written instructions about wound care, hygiene, and medications. You will be taken by wheelchair to your ride. Staff will assist you to get in the vehicle safely. We recommend a standard height vehicle such as a sedan or small SUV where you can ride in the front passenger seat. Plan ahead for an appropriate vehicle to be available when you discharge. If you have stairs outside or inside, railings will increase your safety and confidence. If you have pets, plan on someone holding them or restraining them when you first come home until you are safely seated. They will be excited to see you, but we don't want you to fall. Arrange for someone to stay with you for the first several days and be available to you for a few weeks to assist with meals, grocery shopping, household chores, laundry, getting the mail, taking out the garbage, and caring for pets. Think about how you will carry items when walking with a walker or crutches. Consider using a basket or bag attached to your walker. Backpacks or fanny packs may also be useful. Place frequently used items in the kitchen, bathroom, and bedroom within easy reach, around waist height. Avoid bending too low or reaching overhead. Consider purchasing a reacher to retrieve dropped items from the floor. Sitting in a proper chair can greatly increase your comfort and ease in getting up and down. We suggest a firm padded chair with armrests. Avoid rocking chairs, swivel chairs, and chairs with wheels. The best height for the chair is one where the seat touches the back of your leg 2 to 3 inches above the crease at the back of your knee. If your chairs are too low or too soft, increase the seat height by using folded blankets, chair pads, or foam cushions or blocks, or a platform under the chair. A standard height bed works best after surgery. Avoid water beds, low futons, or mattresses on the floor. Remember to speak to your surgeon about when you may return to driving and work. You may wish to have your surgeon sign an application for a temporary disabled parking permit so you can get that taken care of before surgery. We hope you found this information useful as you prepare for your joint replacement surgery. All of us at Providence St. Joseph Health wish you a speedy recovery.